everyone. Welcome to the Healthy, Wealthy, and Smart YouTube channel. I am your host, Dr. Karen Litzy, physical therapist based in New York City. And today on the podcast, we are going to be talking about integrative and lifestyle medicine and physical therapy. But before we get to that, don't forget to hit the like and subscribe and notification buttons. You know how this works, so that you don't miss a week of really great info and really great podcasts. And today, I'm happy to have two of my favorite physical therapists in the world on the podcast, Dr. Ginger Garner and Dr. Joe Tatta. So Dr. Ginger Garner is a therapist, author, educator, and advocate for improving access to equity to pelvic health physical therapy services. She's the founder and CEO of Living Well Institute, which certifies healthcare providers in functional and integrative lifestyle medicine, and also offers wellness classes to the public on the same topics. She is also the creator of the Medical Therapeutic Yoga Professional Yoga Therapist Certification, the only certification of its kind worldwide for medical professionals. Dr. Garner practices at Garner Pelvic Health, which she founded to offer integrative telehealth and in-person pelvic and orthopedic care. She's the author of multiple books and book chapters published in several languages. She has presented internationally at over 20 conferences, teaching on a range of topics about pelvic and orthopedic health. Ginger is an active member of the APTA, which is the American Physical Therapy Association, the APTA North Carolina Private Practice and Academy of Pelvic Health. You can find her at www.integrativelifestylemed.com. and also obviously on social media. Dr. Joe Tatta, fellow New Yorker, is a global leader in integrative pain care and advocate for the safe and effective treatment of chronic pain. He is the founder of the Integrative Pain Science Institute, cutting-edge health company reinventing pain care through evidence-based treatment, research, and professional development. For 25 years, he has supported people living with pain and helped practitioners deliver more effective pain management. His research and career achievements include scalable practice models centered on lifestyle medicine, health behavior change, and digital therapeutics. He is a doctor of physical therapy, board-certified nutrition specialist, and acceptance and commitment therapy trainer. Dr. Tatta is the author of two best-selling books, Radical Relief and Heal Your Pain, and the host of the Healing Pain podcast. Now, what Joe and Ginger also did is they were the co-editors of an amazing book called Integrative and Lifestyle Medicine and Physical Therapy. Let me grab it. So this is the book right here. So if you are interested in this book, which is an amazing book, it has over 20 different authors from the world of physical therapy, and I was one of them. Yay! So I am now a published author. I wrote a chapter in this book, Integrative and Lifestyle Medicine. And as you can see, it's a really beautiful book. It's a great read. If you're a healthcare provider, if you're a physical therapist, it is well worth the read. And you can find out how to get the book in the comments below. So I just want to give a big thanks to Joe and Ginger for coming on the podcast. Everyone enjoy today's episode. It is a gem. Hello, Joe. Hello, Ginger. Welcome to the podcast. I'm so happy to have you both on. So welcome, welcome.
Thank you. Thanks for having us.
Hey there. Thanks for the invite.
Yeah, and today we're going to be talking about integrative and lifestyle medicine, and of course, about this amazing book that you two were the main editors on. So for the people watching on YouTube, I'm going to hold up the book so you can see how beautiful it is. Integrative and Lifestyle Medicine and Physical Therapy. Nice, thick book. Lots of just really top-notch authors in every single chapter. I was very honored to be asked to be a part of it. And it is really such a great book. And it was published by OPTP. We'll give them a big shout out because they were really wonderful to work with. But we will get to more about the book in a little bit and where people can find it and all the other co-authors in the book. But before that, what is integrative and lifestyle medicine and why should we care?
That's a great question. I'm sure we all have lots to say about that, but the short and simple answer is there's two different systems of medicine that really integrate well with each other. And they both have their origins, although integrative medicine, as defined by the National Center for Complementary and Integrative Health, would define it as a category of a group of therapies which encompass a lot of mind-body therapies, which can include nutrition, it can include lifestyle changes, but it's not, or lifestyle habit changes and behavioral change, but it's not necessarily limited to that, because you can talk about supplemental care, which could mean food-based changes in someone's diet, but also supplemental changes as well. So we're talking about a lot of things, from integrative medicine to then including lifestyle medicine as well as a part of that, which is, there's 6 facets or foundations of lifestyle medicine. And there are things that you and I would think about pretty commonly, especially since all of us practice it. Sleep, stress management, physical activity, nutrition, what we're taking in. That's including also our environment around us. So relationships as part of that environment, but also what we're exposed to every day. Do we have access to clean air, soil, water? What kind of medications are we taking, and what are they doing to our systems? So if we step back from both of those kind of systems of medicine, they are both very systems driven in that they are looking for root cause. And that makes it a lot different than what we were taught and what we learned, because for better or worse, we don't have a lot of space in our physical therapy curricula to wedge anything else in there. And that doesn't leave us a lot of space to become experts at mindfulness, for example, which is a huge part of integrative medicine, or to learn Tai Chi or yoga or Pilates, or to discuss nutrition in any depth. And so Joe and I felt really strongly about bringing a group of people together that could write about this and kind of fill a really, I would say, urgent need today in healthcare, because the CDC, the World Health Organization, unanimously together say, look, we should all be screening for these things. Quality of sleep, for example, in order to determine how we're going to intervene. But unfortunately, statistically, we're not doing it. But hopefully things are going to change soon.
Yeah. Joe, anything you wanted to add to that?
Just as I listened to Ginger speak about these principles of integrative and lifestyle medicine, as she mentioned, all of us are kind of aware of them. But it was interesting as we went through, as Karen, you were with us, writing this book together with us. We had 39 contributors. But as we went through the development of this book, we actually wound up smack dab in the middle of COVID. And what was interesting is all of a sudden, front and center, we started talking, or the press really started talking more about non-communicable diseases and how lifestyle affects those types of conditions, and how those that suffer from those conditions are more likely to have a less optimal outcome from something like COVID. So, I think as physical therapists, we're aware of this content. It is in the DPT curricula, in the health and wellness promotion content typically. And some programs have one course in health and wellness, some have 2 or 3, some are weaving it through the curricula. So it's there. Our goal is really to be more intentional and to create a resource that our profession, the profession of physical therapy, but this book is also useful for OTs and chiropractors and nurses. And just to, be more intentional and say, hey, here's what this is. Let's lay it out in the context of physical therapy, but let's now be more intentional as a profession and as individuals to help people access these types of behaviors.
And why physical? I mean, aside from the fact, yes, we are all physical therapists, but why do you guys think physical therapy in particular is sort of uniquely positioned to fit very well within this integrative and lifestyle medicine model?
Well,
I'll start with that first, and then I'll let Ginger. I know Ginger has a lot to say about this. One of the co-authors is Janet Bezner. So Janet Bezner has been a physical therapist for a long time. She's a fellow of the association. She is a DPT program professor and actually leads a program. is a director of a program, and she did some of the earliest work on health and wellness promotion. And when you look at her, it's a perspective paper that's in PTG. I think it was published in 2015. Everyone can look at it and link to it. She, in many ways, really framed this out for the profession. So it's been there for, greater than probably 10 years. And we still haven't really, I would say, taken this challenge on probably the way we should, knowing that we see people with comorbid conditions. We have the background, we have the skill set on some level, we have foundational skill set coming out of school. Of course, you can always improve upon that. We have the license. And in a lot of ways, we're already integrative. We're already working in things like education or pain education, exercise, manual therapy, even things like modalities and dry needling fit into this to a certain extent. So in many ways, we're already doing it. But I think, we kind of have this little bit of a kind of a call to action to the profession to say, hey, we might in certain ways, in certain places, really be an optimal practitioner to start to kind of fill this void in the healthcare system.
Ginger, go ahead.
Yeah, I think that's says it so well. We have the space and the time, and I say that also thinking about how much we can influence policy to improve that. So while we do have the space and time, I would say we still don't have enough of that space and time. But compared to other practitioners, we are ideally suited to be delivering it, because even in the larger systems, you would get 45 minutes, whereas a PA or other healthcare providers they just aren't given the luxury of time, because they could certainly well deliver this information too. And I think it's a huge team effort for us to look at, first of all, appreciating the time that we do have. And that's, I think, one of the biggest strategies of the book is to manifest it in a way that's practical. Because while there are health and promotion classes and everyone is trying to do their part to progress the profession, we're handed these policy issues that prevent us from doing all that we can. So while on the one hand we have that time, I think on the other hand, because policy is so important, we also can work to expand that and make it even better. So we can do a couple of things. Obviously, serve our patients more thoroughly and look for root cause, which both integrative and lifestyle medicine do, but also be able to make sure we're taking good care of ourselves, because we have burnout and particularly with COVID, the things that we're struggling with, no one escaped loss and job difficulties during this time. So the other beautiful thing about ILM, to maybe shift gears a little bit in what we're talking about, is it's very much can be trauma informed, which is a wonderful, unique thing about it.
And what do you guys say to, let's say, the staff physical therapist who's like, I have to see 2 to 3 patients an hour the way it is. How am I supposed to incorporate all of this other stuff into my treatment plan for my patients? So what tips or advice do you have for those therapists? Or let's say, and I don't want to pigeonhole and just say outpatient therapy, since that's kind of what I do, but you could be in a hospital setting, you can be in a skilled nursing facility or an inpatient rehab, home health. There's lots of different settings. So I don't want to let the listeners who are physical therapists out there say, oh, well, we're just talking outpatient, because that's not true.
Yeah.
Joe, did you held your finger up for just a second? Did you have another point?
I want to talk about policy for just a minute, but
go ahead.
Yeah.
So just on the policy piece, because Ginger and I are always talking about kind of the policies and politics of our profession, so to speak. The House of Delegates has a number of position statements that really have been developed over the years. They really reinforce us using integrative and lifestyle medicine. So, for example, Ginger and I have been involved in some of these actually Complementary and integrative interventions is a House of Delegates statement suggesting that physical therapists use complementary integrative interventions. Ginger played a pivotal role in that, both in North Carolina and on the national level. The role of the physical therapist diet and nutrition I was involved with a couple of years ago. The association's role in prevention, wellness, fitness, health promotion that I mentioned, that's been out there for a long time. Now we have the role of the physical therapist in behavioral and mental health. So really bring in more integrative approach to mental health, not just the top-down cognitive pieces, but how we can bring the body into that type of care. And then I think finally, the most important one is our role as primary care and entry point providers is that, as Ginger mentioned, we should be screening for all these things. Now, I know on some level, to kind of start to answer your question, it can seem overwhelming. And we're not necessarily suggesting that you have to do all of these things at all times. But consider for a moment that your patient, well, two things. First is if you're working in a hospital system, let's say, and maybe your patient is seeing a dietitian or a nutritionist or something like that, or maybe the doctor is counseling on exercise, on nutrition. Consider that all of our clients and patients need to have these behaviors reinforced. So if you can reinforce this as the physical therapist, things like nutrition, exercise, sleep, the patient's more likely to start to develop those healthy habits than just hearing it from one person. The other thing is there's a whole realm of research on brief interventions, things between 5 and 10 minutes. So 5 and 10 minutes of nutrition education, 5 and 10 minutes of mindfulness-based stress reduction. That can be as significant for a health outcome as a 40-minute session. And a lot of people actually do better with really short little pieces of behavior change. So you don't have to tackle these things all at once. You can kind of address these bit by bit slowly as you're seeing the patient, let's say twice a week for 6 to 8 weeks, no matter what type of setting that you're in.
Yeah, I like that.
Yeah, there's a recipe for success that's reasonable, that doesn't put a lot of stress on you for pretty much any setting. I know Joe and I have both been involved for decades in teaching continuing education about this, and the same short intervention also goes for tobacco cessation. In fact, that was one of the strongest pieces of the evidence, was that those short interventions of about 5 minutes were the most effective.
So that takes some pressure off of our everyday clinicians thinking, oh my gosh, I'm supposed to do physical therapy, but how am I supposed to give education for a half an hour? So instead we're talking about little snacks. Go ahead, Joe.
So the other thing that Ginger and I had discussed, and it's in the book, I believe, in the beginning, is just changing our mindset around, one, what we do as licensed health professionals as a primary intervention. And then two, changing the idea of giving people a home exercise program. So instead of prescribing a home exercise program, what if you prescribe an integrative lifestyle medicine program for people? And that really starts to shift kind of really our professional identity in some way. And I know that can be, a little kind of alarming for people where they say, look at it like, well, I do exercise and manual therapy. And that's awesome. And you should continue to do that. But realize that for the kind of comorbid multi-condition person that we're seeing, that might not be enough. And in many ways, we have an obligation as licensed health professionals to really go deeper with people. Again, it's a little bit of a shift in our professional identity, but it's one that Ginger and I have, and not just Ginger and I mean, there are many therapists who have done this type of work for decades. And yes, it takes a little bit of behavior change on our part, but it's extremely rewarding once you're able to help someone on that deeper level.
And what does that look like in a practical way? So most people can wrap their head around a home exercise program. What does an integrative and lifestyle medicine home program look like?
Yeah. To speak to a little bit of the the overwhelm that if you're listening as a therapist that you might feel towards, gosh, how can I implement all this? I make sure that if we're talking about a typical patient encounter, patient comes in, I have them fill out probably more information than the average intake because some of that is their ILM inventory, so that the homework is kind of done on the front end. And then when they're finished with their moment in time with me, they do get, and I use some tech and mobile health apps, that kind of stuff. So technology, yay for tech, does help me get my job done better. We were just talking about this before the podcast, but that helps me do a better job and a more thorough job. It also helps for that behavioral intervention that Joe was talking about to kind of drive home that message of short interaction. So when they're done with me, once they connect to the portal, just practically speaking, then they're given a lifestyle profile that they can fill out in more detail. So then I can dive deeper, because sure, they might have had a brief intervention with sleep, but once they fill out a little bit more information, then I can dive deeper in future sessions. And that way it does give them some of that. The two things that are really important in people following through, which is locus of control and self-efficacy. If they go home feeling that, and one of the ways that I determine that is I send them a follow-up email on the portal of measuring confidence level. And if I can get to that 7 out of 10 confidence level for them, I feel like, well, I must have done something right, that they're feeling good about things. And if not, then that allows me to circle back and go, gosh, do I need to send more instructions? Did I miss something? Did I not do what I needed, to do well in order to help them make that behavior change? But that's kind of a practical ABC of how they come in and how I manage my time, because what if they're coming in for some layered stress urinary incontinence and pelvic organ prolapse, and then I'm supposed to measure all this stuff with it? But that's how it gets done. So the bulk of my work can be on pelvic organ prolapse, and then all the edges, are integrative and lifestyle medicine that kind of bring it all together. And then I call it an IHP, an individualized home program, so that they can carry that and go with it. But that's kind of a snapshot view of how I approach it.
Cool. Joe, how about you?
So I like to look at this from the position of one of our jobs is to empower patients or empower people with health conditions. I hate to use the word patients anymore. I just like to call it people with health conditions, people with pain, right? We're working with people. We one of the things that doesn't really come up too much, I don't think, in school or in practice, is that when people choose the intervention that they want, they're more likely to follow through with it and gain a benefit. And that's what Ginger's really talking about, that locus of control, self-efficacy part. So as an example, I have a person with pain who came to me a couple of weeks ago, and she's been in physical therapy before. And she currently does yoga online with a really nice portal. I checked it out and vetted it 3 to 4 times a week. It's a yoga class, gentle yoga, 3 to 4 times a week. So in my mind, I'm checking off the box. This person's engaged in some type of healthy movement, right? So at that point, what I do is I usually present, and this is on a piece of paper, basically, with imagine a bunch of circles on a piece of paper. And in those circles, it says physical activity, healthy nutrition, sleep, stress reduction, social connection, medication management. And then I always leave one circle empty for other, because it may not be on there. And then I ask them, basically, these are things we can work on together. Not everything is here. Are there other skills and ways I can support you, but where would you like to begin? And it's interesting because people spend time looking at it. And I allow people a couple of minutes just to sit there and look at it. And ultimately, someone will pick 1 or 2, pain education may be in there. Mindfulness may be in there. And they choose the type of skill or behavior change, if you will, that they want to start with. And what's great about that is I know they have some confidence in, yes, I really want to learn how to do this, because a lot of times people hear like, well, I've heard mindfulness is good for pain, or I've heard, ACT is good for pain, or nutrition. So when they choose, it's really them empowering themselves. And it takes a lot of the pressure off the provider as well to figure out, where do I start? Are they being compliant with this? How are they responding to it? So that's the way I approach it with clients.
Oh, I really like that. That's a great approach. And hopefully people were taking notes there. As both of you were talking about kind of how you work with your patients day to day, because I know oftentimes when we both go to different continuing education classes or CSM and things like that, and everybody's like, well, what can I do the next day? What can I do on Monday? And I think both of those were great examples of, this is what you can do today as the clinician, to not only integrate these principles into your practice, but to empower your patient at the same time. So very good examples. Now, speaking of the patient or the client or the person that you're working with, how do you talk to them about all this? Like, what if they look at you like, I came here because I have knee pain. Come on, what are you talking about?
Well, I think that in probably both of our cases, they've probably, by the time they get to us, they know what they're in for. So I think the question would be to the person that works at the large facility, hospital down the street, and the physician maybe referred them and they don't even know why they're coming to therapy to begin with. That's exactly who would ask that question. I came for back pain. I came for shoulder pain. Why are you talking about sleep? And I think that's one of the things that, not to plug the book, but that's kind of one of our main goals is in all the wonderful authors that are in this, is to break it down in such a way that they have these take-home pieces. And also, if you are listening and you have a way to influence what kind of intake forms go out ahead of an appointment, that will help so much. If you can make those a little bit more complex, a little bit longer, maybe slide in a few inventories that you'll read about in the book, that would help you so much. And then you don't have to tackle everything at one time. They can bite off. I know Joe does the I have a pentagon that I throw up for them. And yours is the circles, very similar. And then they can self-direct in that way. And it really does put them in the, we're not the sage on the stage, we're the guide on the side at that point.
Right. And what are, just for people listening, obviously they can go into the book to get more, to dive a little deeper, but what are like your top 3 things that you're like, this has to be on my intake form? If it's not, I am going to be really upset about this.
Oh my goodness.
Yeah,
That's hard because I want to almost cover my mouth and go, I put everything on the intake form.
right. That's right.
I want to know what music they're interested in. As a musician and someone who uses sound in therapy, I want to know what foods they lean towards when they're stressed out. Sweet, salty, what temperatures make them comfortable or uncomfortable. Those are the more obscure questions you may not think of as being on this kind of lifestyle and integrative assessment. But those are the things that tell me, including light sensitivity, sound sensitivity, the therapeutic landscape that I need to create for them when they come in. So if I see that ahead of time, let's just say, and this happened last week, a young lady came in with endometriosis. She's probably going to have that sensitivity. So do I, adjust appropriately, turn off the overhead lights, change the music, make things more comfortable, pull in, more comfortable chair or whatnot. But I would include everything possible that you can. You will have all the typical intake stuff. So we won't waste our time going over those obvious things. But for me, I want to make sure I ask them about all of the 6 pillars, which is in the first section of the book. Those 6 pillars are probably the most important thing. And then after that, with the integrative piece, a question as simple as, what do you enjoy doing that you can't do right now? And, do you like, and I give them a little checkbox, do you even like yoga? Do you care?
Right.
If not, oh, great. Okay. I use yoga as a primary intervention and have for 25 years, but maybe we do something different. I want to make sure that I'm reaching them where they are. So I think that might change clinician to clinician. And Joe, you may have some things to add on that too.
So I'll go a little bit kind of deep into the book here. In chapter 3, which is the chapter on coaching and behavior change, on page 43, there's a really excellent tool called the Physical Therapy Lifestyle Assessment. It was actually created by Janet Bezner and her other co-author, I want to make sure, Mary Sue Ingman. And it's probably a good time for Ginger and I to, of course, say thank you to the 39 contributors to this book. We couldn't have done it without all of you, and we won't have time to name all of you, but just know that we deeply appreciate your work and your research. But just on page 43, there are 5 questions that look at the main lifestyle factors that we spoke about: sleep, nutrition, stress management, substance use. So just 5 questions. From there, I think what's nice is, as professionals, we can kind of mold our intakes based on our patient population, right?
Right.
So if you're seeing a more women's health population, you may modify those. If you're seeing a more chronic pain population, you may modify some of those intake forms. So there's flexibility, which I think is wonderful. You're always probably going to have at least one question around those 6 basic behaviors. So you could just look at it as you're already asking about exercise as a physical therapist.
Right.
You now just have to squeeze in 5 more questions and then figure out, okay, if you have a chronic pain population, then you probably should consider something like trauma and use the PTSD-5, which is just 5 questions to screen for trauma. If you're a pediatric physical therapist.
I was just going to ask that. You beat me to it. I was going to say, what about kids?
Yeah. Ginger, you want to comment on that? You have kids and you work with some.
I'm not a pediatric PT, but they are near and dear to my heart. And we do have a peds chapter. And I think the answer to that really awesome question that you asked is why we put a whole section on special populations. So whatever your special population is, go to that chapter and it's going to be outlined for you. And that is just immediately applicable.
Yeah. And I was just going to ask, what about pediatrics? What do we do with kids? And I just want to highlight, I'm just going to read these. So sorry, everyone, but you're going to have to sit so I can read this. The special population. So like Ginger said, in the book, there are many wonderful authors writing about specific special populations. So there's pain, there's mental wellness and spiritual health, pediatrics, orthopedics, neurology, geriatrics, obesity, diabetes, cardiometabolic health, oncology, women's health, health disparities, technology and telehealth, and then finally building that lifestyle medicine practice. So just know that there are, if you're working specifically in a geriatric population, they got you covered, right? So everything is in the book. So you can go to that chapter and you can then take that information and bring that back into your practice, whether it's in the paperwork that you give out ahead of time, or whether it's how to speak to that population, maybe the nuances that population have, because obviously pediatrics and geriatrics are quite different, right? So orthopedics and women's health, well, maybe somewhat the same, but still every population has its unique markers. And it's nice that the book covers all of that. So sorry, everybody, you had to sit and listen to me read through that part of that table of contents, but so be it.
What's also interesting is when you look at some of the research around kind of these lifestyle behaviors, there are some studies out there that demonstrate that physical therapy patients actually expect that we, as the providers, actually model these behaviors for them. So in some way, they look to us as people who are quote unquote healthy, right? Most of us exercise. Most of us have an awareness around what a whole food plant-based diet is versus a processed food diet. Most of us have an idea about sleep and stress. So a lot of patients they're expecting it. Of course, when you seed it with intake forms or you put things on your website or your social media and you talk about these topics, then they're more likely to have an increased awareness that, okay, this may not just be exercise. We may go deeper on other topics as well.
Yeah. Yeah. And so you're sort of setting up those expectations before the person even walks into your door, right? Have you ever had a patient say, I don't understand why I need to fill all this out?
Sure.
And what is your response to that?
A lot of people, I mean, the people I work with, people who have chronic pain, they've, of course, have seen multiple providers and practitioners before. So I'm very sensitive to the idea that they've been through this in some fashion, at least once before. And I also think we have to keep in mind that, when you have a chronic condition, things like focus and attention can be a limited resource.
Yeah.
So don't feel the need that you have to do all this in the first session. Sometimes I'll have, intake forms that I bring out at session 6. And that's fine. That's okay. Sure, if you can get all the information at your baseline, that's the ideal. But I think as therapists, we should be flexible, and we should really roll with our clients and the people we're working with, and meet them where they're at. And it can seem really at times judgmental almost when you sit down and you fill out 30 pages of asking everything about your life, from adverse childhood experiences to stress to mental health to your diet. We want to kind of meet people and get some good information, but don't feel like you have to do all of it the first session.
Yeah, that makes sense. Ginger, go ahead.
Yeah. Oh gosh, there's so much to talk about in what you were just mentioning. One of the things that I was going to mention in people feeling overwhelmed, and I've focused on chronic pain, chronic conditions. By the time they come to me, they've seen 3, 4, just like with Joe. They've seen multiple practitioners. So I think about this analogy or comparison may help other people who might feel overwhelmed with the incorporating the ILM pieces. Think about if you were going to pelvic PT, for example, would they roll out every single intricacy, I can't say that word.
Intricacy?
Intricacy. Yeah, yes. I found a word I can't say. That is fun. I wouldn't roll out every single thing that might end up happening. We're going to do intravaginal. We're going to do intrarectal work. No, we're not going to give them all that information. They may never come back. So if I know they're going to need a particular sensitive treatment, which might mean for them talking about tobacco cessation, right? If we step away from the pelvic health comparison for a second, then I might be working my way into it just like I would work my way into a regular intervention in pelvic health, that I might introduce a little bit of the idea on the 3rd visit, but it's not until the 7th visit that I'm going to say, okay, are we ready to talk about this or actually do it?
Yeah. So it sounds to me like what I'm hearing from both of you is, hey, get to know the patient, develop that therapeutic relationship. And as you go forward, you can start to introduce more and more as you feel they're ready and receptive to what you're going to be saying, instead of like turning on the fire hose and pushing it all out on the first visit. Because you're right, they'll be like, forget it. It's not the juice is not worth the squeeze here. I'm out.
There's something else we probably should maybe just drill down into just a little bit. As professionals, and all health professionals, like, we are kind of drawn to the idea of doing interventions, finding the best intervention that's going to help our patients. And of course, wrapped up in integrative and lifestyle medicine are certain types of interventions. But the approach that we take as lifestyle medicine practitioners is not so much that I'm trying to find the right intervention, but that I'm more interested in bringing someone on a process of change that's going to be a behavior change that sticks with them for the long term. So the idea that someone comes to me and I give them the quote unquote perfect diet, which there is none, right? That's like the idea of being an interventionalist. The idea that I help people make small nutrition changes each week, cutting sugar down in the beginning, recognizing that a lot of calories come in through sugary drinks. That's a behavior change process. And that's a very different clinical approach, if you will, to working with people than I'm going to give you the one exercise that cures this, or the one diet that fixes this, or the one mindfulness exercise that stops you from instantly catastrophizing, so to speak.
Mm-hmm.
So if we look at this from the behavior change process, then it starts to make a lot more sense than how do I source the right intervention to quote unquote fix the person? Because that's not what we're about here.
Right. Yeah. It reminds me of, reminds me of a time I was with a patient and it was one of those sessions where it was more talking, it was more asking questions, information finding, and then giving education. And we're coming up to the end of the session. I said, "Oh, I'm so sorry. We haven't addressed your," I forget what it was, hip or something like that. And the patient said to me, he's like, sometimes sessions are okay to just give education. You don't have to always do an exercise or hands-on to make it a good session. That's
Amen
what the
to that.
patient told me. He's, and I should also say he's a psychiatrist, but he was like, he's like, remember that if you don't always have to do things, you don't have to feel bad as the physical therapist that you didn't do something physical with them in that session. And that always stuck with me.
Mm-hmm. Mm-hmm.
I mean, that resonates so deeply for both Ginger and I, and we've lectured at conferences together. And again, a physical therapist kind of defaults to, I have to do exercise with the person. But I think your example with that client, Karen, is so key, because we really should step more into the idea of your behavior change therapist. And some of this has come up actually just recently, the idea that we're movement specialists, which we are, but Ginger and I really see ourselves in the profession as behavior change specialists. And sometimes that requires in-depth conversations, education, and or counseling. Don't be scared to use the word counselor. I really do think as physical therapists, we are therapists and counselors. Mm-hmm. And it's okay to spend as much time as you want, as far as I'm concerned, educating someone, because that education is empowering for them.
Yeah. Ginger, go ahead.
Oh, I'm just enjoying now listening to, taking in some of the things that you're saying. I didn't have a particular point to bring up, but I've spent a lot of time teaching yoga philosophy to a lot of healthcare providers over the years. And when you break down the idea of behavior change from an Ayurvedic philosophy and the dosha system, which those of you listening who love yoga or interested in yoga will resonate with you, because there are different ways that we digest information mentally in yoga, according to yoga and Ayurvedic philosophy. Without getting into the details of the 10 sub-doshas and the 3 primary doshas, when someone comes in, I am evaluating how they're mentally digesting that information in order to understand what dosha they might be or sub-dosha they may be, so that I can approach them in a different way. We're learning that if we consider epigenetics, if we consider, genetic expression and methylation and these things that have, and the gut microbiome, that is in real time, minute by minute, changing how we learn and process information and react. Well, Ayurvedic philosophy had a bit of a system for that 5,000 years ago. So that's why I was sitting with what you guys were saying, because that's where I spend a lot of my time, is not necessarily doing those things to that were manual therapy focused. I mean, that was what I learned. I was a licensed athletic trainer. I learned sports med. I did all the integrative, manual therapy training, and then felt quite broken as a result, with back pain and chronic pain. And here I am trying to fix other people. So just to be able to sit with someone in pain who has, in large part, many times been broken by the fractured system and a lack of continuity of care, a lack of we can't say concern necessarily because we don't understand everyone's individual situation, but a lot of them have a large distrust of the system, and it's valid. It's well founded to be able to just sit and acknowledge the experience they went through, and to be able to then reestablish trust and rapport with them, because we, for all they know, are just another healthcare provider. But that's where ILM is so very different, because they come to us, we sit with them and listen, and then reestablish the trust that they lost somewhere along the way in the system, to let them know that we're going to meet them where they are. And fortunately, we have these wonderful systems to step in and help them. So I didn't have anything additional to say, just other than you guys are making great points. And that's really the thrust of what we do with ILM.
Well, I would disagree respectively and say you had a lot to say. So I'm going to disagree
Yes.
with that. And it's, you know, as we talk about behavior change and things like that, I've been doing the last couple of weeks sort of a deep dive into beliefs. And I am of the opinion that physical therapists are in the business of changing beliefs. And I think you can change beliefs by encouraging small behavioral changes and adoption of new habits, where people can then see their body and they are resilient and that they can move forward. Because I also, so you have 3 people who see people with living with chronic pain, but that they can then see that they've got this body that's not so fragile and broken, and their beliefs about themselves can start to change, and they can start believing in their bodies. And I think as someone with chronic pain, once you're able to do that, you can start believing in yourself, and a lot of other things start to open up.
Absolutely.
So I think we are in the business of not just changing behavior, but changing beliefs, and wherever that may take the person you're working with. So that's what I've been doing the last couple of weeks, is diving into the psychology research of beliefs, which has been really interesting. And I suggest if you really want to take a look at how you practice as a therapist, to check your own beliefs and how you're able to affect someone else. It's pretty cool stuff. And I think it all falls into this integrative and lifestyle medicine and physical therapy.
It most certainly does. I mean, you know, if you have someone who's diagnosed with diabetes, let's say, what's the main belief on how you manage diabetes in our culture? Like, what's the primary intervention?
Insulin.
Right. It's medication, right? A lot of the belief in our society is, when I have a chronic condition, there should be a prescription that is used for treatment. And all of us naturally, as physical therapists and other, you know, health providers kind of in the physical medicine space, see there are alternatives. There are alternatives that, 1, really don't cost much at all. 2, will help you live longer and better and stronger. And 3, almost have absolutely no side effects, right? Every medication has some sort of side effect. So yeah, whether you're working with people with pain who have, you know, pain related beliefs, or you're working with people with chronic conditions that have beliefs around, you know, what intervention is necessary. You know, as you mentioned before, expectations, like those beliefs set up expectations and set the whole really plan of care in a lot of different ways.
Right. Well, I mean, let's talk, as we start to wrap things up, let's talk a little bit more about the book. Talk about, because this was not an easy task. This took a long time, but why don't you guys give a quick history on the idea of this book, and then how it went from, this is an idea we have, to now a published book in, you know, couple minutes. You know,
Oh my
in a couple of
gosh.
minutes time.
Yeah,
No, take your
stick
time. I'm
minutes.
joking. Go ahead.
Well, I started annoying Joe how many years ago? Several years ago. I sent him an email, and we started to talk about this far off idea, you know, of discussing lifestyle medicine, which then evolved because I've been using integrative and lifestyle medicine forever, and you know, and so is Joe. So we it evolved and expanded to this idea of, well, we need to encompass the mind-body piece because mindfulness is so incredibly important, and it's not exclusive to just yoga or, and to talk about other things. So it grew beautifully and bloomed really quickly. It's why we have so many wonderful authors, and just a very deep thank you to every one of our authors for all of the hard work they did. And particularly in our little 2-minute piece here is that they all worked on this. We all worked on this during COVID. So that changed the landscape of what we did too. And that's just another heap of gratitude for everybody's patience in working through something we had never lived through before. So I have lots of special memories that I'm taking forward on working with this book and how it came about. But Joe, what's your input there?
I mean, Ginger and I have overlapped, over the years. And as she mentioned, she sent me an email with the idea for this book. And at first we actually questioned, like, are our peers really like ready for this? Are they ready to embrace this? And, we took the time to really select, these are all physical therapists who are either practicing clinicians or they're educators who've done research in this area. And everyone was so excited and so supportive around this book. I mean, the book is now being used in a lot of the health and wellness promotion courses as like the main book. So if you're in PT school, you'll probably have access to the book, but it also has, applications for, clinicians. So Karen, you mentioned part 3 is the special populations. To talk about the book, I want to mention part 1 are the foundations for lifestyle medicine. That's where you're looking at social determinants of health, psychologically informed care, looking at beliefs, as you mentioned before, counseling styles and behavior change, which we've talked about, and then kind of like a biopsychosocial approach. That's in part 1. And then part 2 are all the vital signs, which we spoke about. Mm-hmm. So we really tried to make it a comprehensive book that really encompasses everything. And in a way that's also concise, right? Because these are really, really big topics. And the feedback really has been tremendous from everyone. And we're, what's amazing is we're seeing therapists now change their practice. And they're starting to, slowly but surely weave more of this into their approach. And I really think it's going to change the DPT curricula, especially. Because the way the Ginger mentioned, like she first was an ATC, all of us kind of came probably from more of like an ortho and sports background. But our profession and our scope of practice has changed as population health has changed, right? We see more and more chronic disease. So we have to shift our scope and shift our approach to address those types of things.
Yeah, absolutely. And as the population is aging, we're seeing with baby boomers, this huge population of baby boomers entering into their 70s now, I guess. We're definitely seeing a lot of more, let's say, layered cases of people coming in to see us, where I think this approach can be very helpful.
Mm-hmm. It's very COVID sensitive in terms of shifting and interventions as well, because of some of the practices that are in the book. So that's also really helpful right now. And I guess in a way, it's very much, we set out to write and edit this book as a way to change beliefs for not just the patient, but for our profession.
Mm-hmm. Yeah, I love it. And like I said, it's beautiful. I mean, and listen, guys, it's easy to read. It's not like you're going to be overwhelmed by complicated stories or things like that. I mean, it's a great book. It's a great read. And like you said, the goal here is to change beliefs, not only of the patients, but also of our profession, and to get people to change the way they're doing things, start being more integrative, not to use the title of the book. And before we wrap things up, what I want to say is to all the people listening to this, if you want a copy, if you want to win a copy, I am going to give away a copy. So all you have to do to get a copy of this book is I am going to, so today is Monday. So tomorrow, Tuesday. So just in case people are listening, I am going just go to my Instagram, which is at Karen Litzy. That's the Instagram. And I will have a picture of this book again for those watching on YouTube. And all you have to do is comment underneath it, and you will be in the running to win a copy of the book. Now, if you don't win a copy of the book, where can people find it?
So they can find it by going to the website at optp.com and just type in integrative and lifestyle medicine and physical therapy, optp.com. It'll come up. If there are international listeners, which I know you have, Karen, it's a global audience, they can go to Amazon and you can either order it internationally in some countries, or you can download it as an ebook.
Perfect.
Ooh, I also wanted to mention that because we could not fit every single thing in chapters, we do have supplemental materials online. All of our references are online because we wanted to put the maximal amount of practical information in the book. So all of our citations are online, and you can access those with codes in the book.
Perfect. And where can people find you guys if they have questions specific to you? Joe, go ahead.
You can find me at the Integrative Pain Science Institute.com.
Perfect. Ginger?
IntegrativeLifestyleMed.com.
Very well done. And we will have links to all of this, to the book and to both Joe and Ginger at podcast.healthywealthysmart.com. One click will take you everywhere. So last question. What advice, and this is for both of you, what advice would you give to your 20-year-old self? Knowing where you are now in life, career, family, et cetera, et cetera.
Ooh. I think mine is going to be gender driven because women kind of have to have a bit of an uphill battle. So I would say to myself, trust your instincts and don't doubt yourself. Self-reflect all you want, but don't overthink it and self-doubt yourself, because you really, and I'm speaking to all the other 20-some-year-old therapists that are out there listening, you know more than you think you do, and you can succeed. So that would be my message.
Great advice. Joe?
Mine would be to cultivate your own natural curiosity about things. I think as, doctoral trained licensed health professionals, we have such an incredible base of knowledge, and really start to, obviously appreciate that base, but then start to kind of build on that and just, think to yourself, what kind of practitioner do I want to be? And then how can I cultivate skills that maybe just be slightly out of, physical therapy? Because Ginger and I were both curious about things like nutrition and mindfulness early on. And way back when we started using those things, we had no idea we'd be writing a textbook about it. So just our natural curiosity of how can I help people further really has led us here. And it can lead your career on a really interesting trajectory when you do that.
Excellent. I love it. Both amazing pieces of advice for anyone listening. So Joe and Ginger, thank you again. And everyone, the name of the book is Integrative and Lifestyle Medicine in Physical Therapy. You can get it at optp.com, or internationally, you can go onto Amazon. Again, we'll have all the links at the website. Thank you, Joe. Thank you, Ginger, for coming on. This was a great talk. Appreciate you guys.
Thanks so much, Karen.
Thanks for having us.
And everyone, thanks so much for listening. Have a great couple of days and stay healthy, wealthy, and smart.